Good morning, everybody. In New South Wales, we had just over 14,000 tests in the last 24 hours, which is very good for a weekend, but obviously we want more people to come forward and get tested, even with the mildest of symptoms. We had 10 cases in New South Wales, although it's important to note 6 of those were in hotel quarantine, so just 4 in the community, all linked to the CBD cluster, and Dr. Chant will give a further update. But it's pleasing to know that our fears about the CBD cluster have yet not materialised, in that it's been contained, and I want to thank to this point in time, and I want to thank our health officials in particular for being so diligent, because potentially that could have seen a number of more cases. We're not out of the woods yet in relation to that cluster, but it's pleasing to know that the rates of community transmission are not as bad as what we'd first anticipated, given the potential for the virus to spread amongst people coming into the city from various different locations. I also wanted to thank the vast majority of our public for enjoying the outdoor weather but keeping a social distance. Assistant Commissioner Casa will give an update, but pleasingly police gave very positive reports about people's behaviour, about social distancing, and I think this augurs well for the future. Today is the last day of winter, and I'm pleased that we got through the winter months as well as we did, and now that the warmer weather is upon us, can I please ask everybody to think about their activities when they're out of doors. As Dr. Chant tells us, to be outdoors enjoying the sun is a healthy experience. Just make sure you keep your social distancing. Enjoy the time with your family, but if you're with friends or people outside your household, please make sure you're always maintaining your social distancing, and in the main, that was found to be the case. So to date, New South Wales is holding our own. Every day is a battle, and that's why it's really important to encourage people who have the mildest of symptoms to come forward. Normally August, September is the peak time for the flu, but obviously because we're all hand sanitising well and keeping our distance, those numbers haven't materialised. But what that means is if you do have a symptom, you should assume it's COVID, not the flu, because we know the rates of flu are negligible to very low. So if you do have the mildest of symptoms, you need to assume it's COVID, it's not the flu. And as we said last week, please don't wait till day 2 or 3 before you have a symptom. Please go the day that you feel unwell and stay home and isolate until you get the results and the advice from health. I now ask Dr. Chant to give her update. Assistant Commissioner Casa will give an update on compliance over the weekend, and then we'll take any of your questions.
So there were 10 new cases of COVID were diagnosed in the 24 hours to 8 p.m. last night, and there were 14,232 tests performed. Of the 10 new cases to 8 p.m. last night, 6 are returned travellers in hotel quarantine, and 4 are locally acquired and linked to a known case or cluster. All 4 locally acquired cases are linked to the CBD cluster, and these include 2 who are household contacts of previously reported cases and 2 who are close contacts of previously reported cases. There was also 1 previous case from southeastern Sydney whose source was under investigation and had been linked to the CBD cluster, and the case was a passenger on a bus at the same time as another previously reported case and may have shared some other exposures. So that's being further investigations of that, how that transmission occurred is underway, and we have reached out using Opal card data to identify people who were travelling on that bus. Pleasingly, 10 of the 11 other passengers on that bus had their registered Opal card details, and we've made contact with 7 of them through their mobile phones and have left messages for the remainder. One passenger on that bus did not have a registered Opal card, and therefore we are still making the public aware of the bus route and the details. In terms of cases under care, we've got 66 COVID cases being treated by New South Wales Health, and including 6 in intensive care, 4 of whom are ventilated. There was also a couple of other localities that we wanted to highlight. Anyone who attended the following venues is considered a casual contact and must monitor for symptoms and get tested immediately if they develop. After testing, you must remain in isolation until a negative test result is received. And so that's the Woolworths Balmain from 10 a.m. till 11 a.m, the Chemist Warehouse at Balmain on 293 Darling Street, Balmain on Friday the 28th of August from 2 to 2:30 p.m. Sushi Rio, 345 Victoria Avenue, Chatswood, Thursday the 27th of August from 5:45 p.m. to 7:30 p.m. and Coles St Ives Shopping Centre on Friday the 28th of August at 1 to 2 p.m. So just to clarify, anyone who attended those venues is considered a casual contact and must monitor for symptoms and get tested immediately if they develop. After testing, you must remain in isolation until a negative result is received, and that is essential. Also, one case worked at the Redham Early Learning Centre at Linfield for 3 days on the 25th to the 27th of August before becoming unwell in the evening of the 27th of August, and the centre has been closed while cleaning and contact tracing is underway. In terms of the updated advice for aged care, late last week on the Friday, we were starting to become very concerned that the CBD cluster may have led to seeding in a number of other areas. Obviously, a number of people travel into the CBD, and we knew that some of those individuals were out and about unknowingly because they were in that pre-symptomatic period, but were infectious. We've been closely monitoring cases associated with that cluster, and it's pleasing to see those case numbers are low. We're still urging anyone who has symptoms to come forward for testing, but if this reassuring picture continues, we will be updating our aged care advice later in the week ahead of Father's Day, and may well be able to ease some of those restrictions on aged care. Thank you.
Thank you, Premier. Good morning, everybody. Yes, over the weekend we saw large crowds out and about in the Sydney and regional New South Wales. We saw large crowds in parks, out and about beaches and on the snowfields. By and large, they were all enjoying the warmer weather, but certainly complying with the requirements of the health orders. No infringement notices were issued, which I'm very happy to say. We see that complacency is probably one of our biggest risks when we are looking at this pandemic, and we ask members of the community to continue to act responsibly and to comply with the health orders. Thank you.
Dr. Chan, regarding the X39 bus and the 2 cases that were travelling on that bus, is it a working theory that they may have, one case may have contracted it from another case on the bus?
That's correct. Our investigations are ongoing, but we are open to the hypothesis that the transmission event occurred on the bus. We're currently going to review CCTV footage, and hopefully that will clarify where the position of people. But we do also know that the 2 people got disembarked. It was disembarked at the same stop. So we're also looking at other crossover points in terms of the individuals.
And given that it may have transmitted, the virus may have been transmitted on the bus, do we need to look at different guidelines for people using public transport, perhaps changing the capacity on public transport or mandatory mask use?
So at that time, the Opal card data indicates that there were 14 people on the bus. And one of those was a couple that we know of. In terms of the spatial distribution, that will be gleaned from the CCTV footage, but 14 is within the bounds of not being a particularly crowded bus. We clearly have been messaging for many weeks about the importance of mask wearing, and I'd again like to call out to the community. When you're in situations such as on public transport, on your buses, trains, when you're going to supermarkets or when you're going into out and about and you know that you're going to be heading into environments where social distancing is not practical, or you'll be put into those proximity with people, please wear a mask. It's just one small step that we urge the community, and that will assist us in reducing the risk. In this case, the person who was infectious reported wearing a mask, but we are going to confirm that to be the case. But certainly the person who then became infected was not wearing a mask on the bus. But as I said, it's important in these circumstances that we check and recheck our facts. As I said, memory and recall can be difficult when you're looking at going back over a period of 10 days and asked what your practices were. So we do want to look at the CCTV footage. We're keen to learn any new information, but at this moment, obviously, we're considering that transmission may have occurred on the bus, but we are exploring other routes, and that's why we've asked for the CCTV footage. And I'll be able to confirm whether we've been able to access it. Just for your information, there is a loop where the CCTV footage loops over itself, and that's currently on a 10-day. So we think we've got it in time, and we also Transport kindly agreed to extend that duration of holding those tapes for us for future investigations.
Doctor, is there a reason that you're not recommending to the Premier why masks shouldn't be mandatory? Because there are more calls this morning from different groups.
Look, at this moment, we are continually keep our policy advice around masks under review. What's been pleasing to see is the uptake to mask wearing in the community. Our data out of Service New South Wales indicates that following our advice to the community and strengthened advice around the importance of mask wearing, we've certainly seen increased mask wearing. I would also like to indicate to the community that masks are readily available. If you're out and about, chemist shops, a number of settings have masks available. And so some of those barriers to mask wearing, I just want to reassure the community that when I've been out and about on Sunday, I certainly did see a lot of more availability of masks for the general public.
What is the medical reason for not making it compulsory?
So the issue is that we need to work through the policy issues. We need to work with the community and take it along with us. Once we make it mandatory, it will mean that there will be no exceptions to the rule. And we need to give the time for the community to certainly embrace masks, get used to them, and to acquire them. Clearly, I'm strongly saying that mask wearing add one additional layer. It's important that they complement the already key messages, which is do not go out and about if you've got symptoms. Please stay home and get tested. Similarly, we need that good, strong hand washing, and mask wearing is something that I strongly recommend, and I recommend it for all settings, including when you cannot socially distance. And we know on certain times on public transport that is challenging. We know when you're in supermarkets or other crowded environments, and that's the time to wear masks. And I would like to see that raised across the population, not just only on public transport.
So what's the difference then between strongly recommending it and making it mandatory? Because it doesn't seem to be much difference with that just in terms of enforcement.
Well, certainly in terms of enforcement, it means that then people would no longer be able to get onto that bus if they were not wearing a mask. We just need to work through with the community to increase access to masks. We need to take the community on the journey and explain the importance of masks and why we're recommending them at this time. We clearly have seen a greater acceptance, and the data indicates that there is a growing acceptance of mask wearing. And I think I've certainly been out for probably the last 4 weeks stressing the importance of masks as a complementary action. And when we're battling COVID, we should use all of the tools we have available to us to tackle this quite insidious and stealthy virus.
But you still haven't really answered the question. So what are you worried about, like a public pushback, or is there a medical reason not to make it mandatory? Because everything you've said seems to point to the fact that they work.
So they are believed to be effective, particularly if you are infectious in blocking the transmission. That's why we're encouraging people to get out and about. The issue is once there's decisions around making it mandatory, then it has consequences for people who are not wearing masks. We have to work through those issues. So our mask policy...
When you say consequences, legal consequences?
Well, consequences that you can't get on the bus or you can't get on the train. We need to look at the age cut-off. There'll be some members of the community that won't tolerate masks for a variety of reasons. And we need to work through those issues. So our advice around mask wearing, I think one of the lessons we've learned about in COVID is it's important that we talk openly to the community about the evidence. And I have been so pleased with the response of the community when we've given advice. And at a certain point, we have to make those decisions of when it moves from advisories. But in general, the community has responded incredibly well to advice, and that is indicated by some of the data we've seen from Service New South Wales, where the community over recent weeks has really continued to adopt mask wearing.
But Dr. Chandler, the video from Transport New South Wales seems to show across the system that only the numbers are about 30% of people, of commuters, wearing masks. Is that the number you're satisfied with, or would you?
So certainly the Service New South Wales data gives different data in terms of the general acceptability of mask wearing and people reporting mask wearing. I've asked my colleagues in Transport to provide us with data, and that will be taken into account in formulating our advice around the next steps.
What is the latest number you've got in terms of percentage? I mean, you might know, the last advice we had from Transport was it was around 30%. So is that increased?
The last advice we had through Service New South Wales was that mask wearing was as high as up around 60-something%.
On public transport.
Correct. But again, we get that data updated regularly. Today, as I did a spot check on a bus I was next to, and everybody except one person had a mask on there. And that is very good compliance. But we've been saying from day one, if I was catching a bus or a train today, I would 100% be wearing a mask. You should not be catching a bus or a train if you're not wearing a mask. It doesn't get more simple than that. And we have to also put our response to the pandemic into good, comparison to what we're experiencing in the community. If you look at the rate of transmission in restaurants, in hotels, in gyms, I mean, this is potentially the first one we've had on public transport, and I say potentially because Health's still doing their advice. What we have to do during a pandemic is look at the overall picture, because when you adjust a policy mechanism, you have to do it across the board in a whole range of different areas, because you can't prevent transmission happening in a whole range of other venues where people are mixing. And that's why we say the mask is very important, but it's the fourth line of defence. And you have to consider a whole range of options, and you have to also consider where you are, what stage you're at in the pandemic. Now, the health advice is always evolving, and the advice we get from customer service and transport and other agencies is always evolving on the percentage of people who are complying. And if you recall, we said to businesses, if you don't show greater compliance and being COVID safe, we'll have to put in more restrictions. We've said to people on public transport, please demonstrate your capacity to increase compliance, and we've seen that happen. But we would not be afraid at any stage to change our advice if that was a strong recommendation from health. But what we need to do is assess the risk overall, assess people's behaviour, and even when you do make things mandatory, as we've seen, there are always people that don't comply. It's a small percentage, but it only takes a few people not to comply. So please know that if the health advice changed on that, we wouldn't hesitate to act. But you need to put it into perspective. You need to put into perspective as to which stage we're at in the pandemic. And you also need to put it into perspective in terms of the number of cases, how they're spreading. And we know the greatest risk to getting the virus is from someone you know well. It's a household contact or someone you're socialising with. We know, because of the data, that is the highest risk. The random contraction of the virus is the least risk. It is a huge risk, but it's a greater risk to get the virus from a household contact or somebody you're socialising with. And that's why our response has to be commensurate with the risk. And you have to make sure you bring the community with you. You have to make sure you assess the number of cases you have and where you're at. And our advice on masks can't be stronger. If you're going grocery shopping, if you're at a crowded supermarket, if you're on public transport, if you're somewhere where you can't guarantee social distancing, for heaven's sake, wear a mask. If you're going to a place of worship, you should be wearing a mask. If you're going anywhere where social distancing could be compromised, and not necessarily through your own actions, but through somebody else's, wear a mask. That is the strong advice. And to date, I want to thank the community who have taken the opportunity to update. And as I said, I'll get a further update on Wednesday, but the last update I had mask wearing increased substantially. And that's the trend we want to see continue. Similarly with businesses. We've seen the number of businesses who register through Service New South Wales to say they've got a COVID safe plan has also increased, because we sent a warning to businesses to say, if more of you don't register, if more of you don't have a COVID safe plan, we will need to put in more restrictions. But I think, as Dr. Chant said, it's also appropriate to give the community the chance to take up the opportunities we're giving them, to take on board the advice we're giving. And if at any stage that changes, we will do that. But please also note that for every decision we take, there's always detractors. And I, as you may know, aren't going to be swayed by the detractors. I'll be swayed by the health advice and where we're at in the pandemic. and I'll also be swayed by where we think New South Wales is heading and what mitigation actions we need to take. But in summer in particular, when people are outdoors and social distancing, it's actually healthy. If you're socially distancing to get fresh air, it's much healthier to do that than to be in an indoor environment in a confined space. So we need to put things into perspective. We need to make sure people have the opportunities to take our advice. But I can't be, and Dr. Chant can't be any clearer than if you're catching public transport, if you're going shopping, if you're somewhere in a confined space where social distancing can't be guaranteed, especially at places of worship, you should be wearing a mask, and it doesn't get clearer than that.
Yeah, on that premise, so that you're thinking about, if, at this point, it sounds like there was potential that on that bus it was transmitted, but someone was wearing a mask, so in that case it didn't stop the transmission.
Well,
right?
that's exactly the point, and that's why you need to assess the risk. We know this is an insidious virus. It can transfer from surfaces, it can transfer through other mechanisms. So therefore, every time we have a case that might have different circumstances, we can't react in a way in which it's going to change the whole strategy.
So do you think mandatory mask wearing could be a bit simplistic?
Well, I feel it could give people, well, the health advice says it also could give people a false sense of security, because what we don't want is people with symptoms thinking they can wear a mask and go out and conduct their business, because that won't work. We need to make sure people appreciate as soon as you get the onset of symptoms, and that was our biggest concern last week and remains our concern, people are waiting 2 or 3 days before they get the test. Please do not wait. Please do not wait. Get tested as soon as you feel the onset of a symptom, no matter how mild it is. We have to assume it's COVID, especially if you live in southwestern and western Sydney, because we do know the virus is circulating amongst the community. And our advice can't be stronger than that. Absolutely, masks are important. Absolutely, they're critical in part of our defence to the pandemic. But all of our policy settings have to be commensurate with the risk at any given time. And we also need to consider the broader implications of anything we change, because it does have a huge impact on other parts. For example, at the moment, we've not said you have to wear a mask if you're in hospitality, but we know most venues are requiring their staff to wear a mask, which is a great sign. We haven't said to businesses, you must have a COVID safe plan, you must register formally, but most are. So these are good ways in which we've seen compliance increase. And we've also seen the results of that in that we've been able to, by and large, contain the spread of the virus. The unknown cases always worries me. I know it worries Dr. Chant. The accumulation of the unknown cases is the biggest risk, because what that tells us is that the virus is circulating. People may have accessed it from a particular venue or a particular spot which we haven't identified. That for us is the biggest risk.
Premier, in regards to borders, will your government this week change the health orders to allow the free movement of farm contract workers or agriculture workers from Victoria into New South Wales, similarly to how freight workers are allowed across state lines, in line with what John Barilaro and Adam Marshall have called for today?
Well, firstly, Minister Marshall will be joining all of his agricultural ministers tomorrow to have a national plan, and we'll be discussing this at National Cabinet on Friday. I think it's important for us to have the same rules across the